So what should healthcare reform look like? Hi, everyone. Welcome to the Healthcare Secrets Podcast. I'm John Daly, along with Judd Anglin. Now, we're not going to get political on you here, but we are going to look at what is wrong with healthcare and the lack of real reform in America. And we're going to tell you things that people are not going to tell you about because your life depends on this. Judd, you touch on this in your book, The Big Book of Healthcare Secrets. I want you to scare the crap out of all of us. What are we looking at in the next 5 to 6 years?
Yeah, that's really interesting. What we're basically looking at is we are facing the perfect storm right now in terms of healthcare in America. And you're certainly not going to hear this on the news. Let's look at what we're facing. Number one, we actually have a severe doctor shortage in the U.S. Now, according to the Association of American Medical Colleges, the U.S. is short more than 90,000 total physicians by next year.
Wow.
But it gets worse. 130,000 physicians by 2025. Then when you combine that with the fact that the Medicare Board of Trustees announced last summer that we're actually, their projections were wrong, so the fund will run short of funds by 2027.
Wow.
Then, on top of that, we have the baby boomers. There are approximately 10,000 new baby boomers every single day and will continue over the next decade. And of course, think about it. Baby boomers are the ones that need the most health care later in life. So that's what we're facing. And these issues are not being talked about. It's all been very political. And, you know, the left versus the right, free markets versus Medicare for all. But we're not even looking at the real problems.
Absolutely. Absolutely. Okay, you laid that out beautifully. Let's talk about some of the solutions that we have looked at. And I'm going to kind of look at it in a broad sense. Let me start, and I'm going to let you kind of jump in there at some point. First, it would be to have individuals take responsibility of their own health care. Now, that means getting healthy by changing your lifestyle. That means diet, exercise, reduction of stress, just to name a few. And Judd, this is what I keep telling folks. The bottom line is this. Only you as an individual can change healthcare. The healthcare industry does not want to change it. They're beholden to shareholders who want money and profits. And remember, money and profits only come when you are sick. That does not bring you good health care. Your lawmakers, they're not going to do it either. Why? Well, many of them are beholden to the same special interests connected to the healthcare industry. They're going to take money from them. In addition to that, most of our lawmakers are absolutely clueless when it comes to what is good health care. So what do you think of that? Give me your solutions, and feel free to nuance my solutions too, because I just get so angry about this.
Same here. You're absolutely right in what you said there. And think about this. When Obama came into office, the first issue that he took on was healthcare reform through the Affordable Care Act, Obamacare, right? And you remember he made all these promises that, if you liked your healthcare, you could keep it. And he was going to reduce the cost of healthcare and make everything work well. Well, what happened? He allowed the insurance companies to come in and write the law. And how do you think they wrote that law? Well, lo and behold, it comes out that, everybody has to have insurance. And did that decrease the cost? No. Did it increase competition? No, of course not. So it was the worst solution possible. We had a cost problem. That's where the solutions needed to be met. But then not Obama, but when Trump was running for office, he promised repeal and replace. He was going to come in and repeal it and replace it with something much better that would be workable. And here we are now, almost 3 years later, and he repealed a lot of it, but he hasn't replaced it with anything. So he was right when he said that Obamacare is going to just fall into a disastrous state of oblivion, right? And here we are. But it's true. Costs continue to skyrocket. There's some families out there, John, that are paying close to $3,000 a month on monthly premiums. How can people afford that? That's insane.
Yeah, $36,000 a year. For some people, that's their yearly salary.
And a lot of these people are healthy and they don't even, need to see a doctor, but maybe once or twice a year. And if that is for a physical, yet they're paying all that money. But then, also the deductibles are very high. So even if they did go to the hospital, it's quite possible that their deductibles could be $8,000 to $10,000. So your insurance doesn't even kick in until you, you reach that threshold. So that's just, that can't work, obviously.
No, and unfortunately that is the reality. All right, everybody. John Daly here, along with Judd Anglin. This is the Healthcare Secrets Podcast. Our website's really easy. It's the healthcaresecretspodcast.com. You can also see us on Facebook at healthcaresecrets.com, or I should say at Healthcare Secrets, and on Twitter at Healthcare SECR and then the number 1. And you can see some of our shows on YouTube at Healthcare Secrets Podcast on YouTube. Give us your comments and questions on any of those platforms, or you can write us at info@healthcaresecretspodcast.com. Okay, so more specific solutions. Let me throw these at you and see what you think. I think the system has to change so that individuals, and you just said this, they go out on the market and they act as consumers when it comes to elective, non-threatening medical procedures. So let me use the knee replacement as one. Let's say you need a knee replacement. You can go out and search whoever does the best and does it for less. This is why I would eliminate also the employer deduction for offering health care to employees. Now, other people can say, oh, wait, you're going to make our costs go higher. Actually, no. All this does is it keeps the cost of health insurance higher because the bigger the deduction, the better the savings for the employer. Plus, the employee does not act like a consumer because the insurance is, according to them, paid for by my employer, not me, so I'm not going to be a discriminating consumer. Now, next, I think that every American should have a catastrophic plan. So and let me use this example. Let's say your wife has terminal cancer. You will do everything you can to make sure she is either cured or taken care of. The difference is when you have a non-life or death situation like a knee replacement, you can then use supply and demand and free market principles. You can go out there and negotiate and look for the best. But when it's life or death, supply and demand to me goes right out the window. You will do anything to save that loved one. That's where the healthcare industry takes advantage of the individual. When that supply and demand goes out the window, when you can't be a consumer and negotiate to work what capitalism should be doing. So if we had a safety net for catastrophic, everybody had to have that. And then everybody has to go out on the market on their own, not have their employer do it. I know that requires a lot of work, but if you want to bring healthcare costs down, to me, that's what needs to be done. Tell me if I'm wrong.
John, you're right on. When you talk about insurance, for example, it's a big part of the problem. The way I see it is, I think the way to bring the cost down in a perfect world would be to have that catastrophic plan. What if catastrophic insurance kicked in at $10,000? Your deductible was $10,000. What would that do? Well, obviously, that's a lot of money for most families to have to go pay $10,000. But you know what? They would be negotiating in most cases. Obviously, if you're coming into a hospital with an ambulance and you're unconscious, clearly you can't do that. But if the vast majority of cases, people would go in and the doctor says, yeah, I'm going to do the knee replacements or you need to have an appendectomy, your first question would be, Doc, how much does that cost? No, I don't want to pay that, right? It would force healthcare providers to come up with more creative ways and lower prices. So I think that would be the best. Here's something else. I read this in a book last year, and this is amazing. You can get a total heart bypass procedure in Bangalore, India. I'm talking about total bundle price, which includes absolutely everything. Bangalore, India, heart bypass procedure, $1,600, right? That's insane.
Isn't that amazing? Isn't that amazing?
And this book compares that to one of our top hospitals in the U.S., which is Cleveland Clinic. That same heart bypass procedure cost, best estimate, $110,000. Now, that's a big difference. So people, listening to us might right now say, "Oh, yeah, that's probably like a dilapidated hut in some slum in India." Not true at all. No, we're talking about ultra modern hospitals using the same protocols and procedures. Yeah. Probably a lot of the doctors actually working in the U.S. for many years or went to medical school here, went back there using the exact same equipment. But the way you compare that is you look at the infection rate and mortality rate. So that hospital and the heart bypass procedure, comparing it to Cleveland Clinic, exactly the same. That is totally amazing.
Isn't that amazing? In that it's unbelievable when you think about it. And we're going to talk about medical tourism a little later because that's one of our other solutions. But the fact that you find that and that is available is absolutely astounding. And we look at what we do to individuals here.
But John, real quick, let me draw a conclusion on that. In using critical thinking, we compared the prices in India, U.S. There's many factors for that. But doesn't that bring up the critical question? It's like, well, why does our insurance companies, why do they pay so much for a heart bypass procedure if it can be done for so much less? Well, here's the reason, I believe, is they want to pay that because they want every single policyholder to believe that health insurance is the most important thing they have because it's catastrophic if you don't have insurance. And it is. It actually, medical cost in the U.S. is the leading cause of bankruptcy and has been for the past decade. So it is true. You have to have it, but they don't want people to, go after the health insurance and say, you can't continue paying this. This is maddening.
Yeah, it's not real capitalism. It's taking advantage of individuals at the worst time. When you were mentioning about being wheeled in the ambulance, Stephen Brill wrote a great book, and he's writing about healthcare, but at the same time too, he had a heart problem, and he literally had to be wheeled in. And they said, we've got to do open heart surgery right away. And they said, oh, by the way, can you sign this here now? And he had to sign while he's on the stretcher. And he was like, oh, wait a minute, that's not right. But he says, I had to sign it. He said, I was going in for open heart surgery. So when you see these things and you hear stuff like that, you just kind of go, okay. I mean, they're taking advantage of us. And unfortunately, we are allowing it. And that's the thing that's so annoying. I want to get into some of what I would say, some of the solutions we're hearing about, because I want to go back to kind of what you were saying as far as medical tourism, because that kind of ties into it. But the one everyone's talking about is this Medicare for all. And I think this is one of the biggest non-solutions out there, because all you're doing is you're getting rid of competition. And, not to, Alexandria Ocasio-Cortez. I'm not knocking her. And I'm not praising any of the Republicans who knock her for this. This makes absolutely no sense. It makes no sense whatsoever. You're just destroying competition. I think it's going to make things worse if we go. Tell me your opinion.
You're absolutely right. I'm totally against that. Look, here's the deal. During healthcare reform under the Obama administration, they talked about the free market. We tried the free market and it didn't work. They were absolutely wrong. There are so many solutions out there that people don't know about. Let me give you one right now.
That we never tried. We never tried.
See, this is all an agenda. And that's what we got to get at. We have to learn the truth. We have to identify what these secrets are, which is part of my book, right? We have to know what the real truth is and not be beholden to the elite's agenda. And that's what we've fallen into with healthcare. A term that you use a lot is political weaponization. And that's what they've done with healthcare. And that's why I truly believe it's not going to be solved, because too many people are making money off of healthcare. It's the most profitable industry in the world. And if you think about it, we have 320 million people in this country, right? And here's the thing. We all need healthcare. When you're in pain, you're suffering in pain, you'll pretty much pay anything to alleviate that pain. And your family members will too, which is understandable. Nobody begrudges that fact. And we're not saying that if you can't afford it, all too bad, you don't get health care. No, everybody should have health care. I totally believe that. But we're way smarter. You know how, like, during the debate, they always said, oh, we're only industrialized country that doesn't have socialized medicine, which Medicare for all is. When I heard that, I have a different perspective. I'm like, man, we're smart people. And we're innovative. why don't we come up with something that really works? Because you can talk to Canada, you can talk to England and all the other countries where they have socialized medicine, and they'll say, yeah, it's nice because it's free, but our taxes are way high, and you know what? We just live with it, and it's good. But they'll be on, if they're honest, they'll tell you it's not a perfect system. There'll never be a perfect system. I mean, I'm sorry, but that's just the way it is. There'll never be a perfect system, but at least if we come up and we look at the real problems, we can come up with solutions that really work for everyone. That's what I want to be. I want America to be that, not to say, oh, every other country has socialism. Why don't we do that? That doesn't make sense to me. Maybe I'm too much of a patriot and I believe in the American spirit, but that's what I would like to see. And that's where we're leading to here is that free market, it does work. It's been working in healthcare and continues to work. Let me give you one right now, a solution. MedRetreat, I get, people contact me a lot looking for more affordable procedures. And I don't want to send them, to India for every case or Malaysia or Thailand.
Okay.
Let's look at hernia repair. I've had a lot of people call me, and without insurance or high deductibles, they're looking at about anywhere from $20,000 to $24,000 for a simple hernia repair. Okay? But here's one that nobody tells you about. You're not going to find in the news. There's actually a company. You can go on your internet browser and look up affordable hernia surgery. And this is a clinic in Rockville, Maryland that charges $2,100 for a flat rate hernia repair. It covers everything. So I had a gentleman last year, I won't give his name here, but he called me from Colorado, and he had the quote of $24,000. I asked him if he heard about it. He hadn't. I sent him the information about it. A few months after that, he sent me an email and said, "Thank you so much. I flew from Colorado to Washington, D.C., stayed with a friend in Rockville, had the procedure, stayed there a few days, flew back home, and the money I saved, I was able to donate to people that were wiped out by Hurricane Harvey." How awesome is that? And we have tons more solutions like that we'll get into, in the podcast. So it does work and it will work. But like I was saying, it's just not a part of, the media agenda or the government's agenda or big healthcare industry's agenda. They want to keep you coming and doing their solution. And if you have to, go bankrupt.
And this doesn't make money for them. When you're healthy, you are not making them money. Just got to remember that. He is Judd Anglin. I'm John Daly. This is the Healthcare Secrets Podcast. Our website's very easy. It is www.healthcaresecretspodcast.com. You can also see us on Facebook at Healthcare Secrets Podcast and also on Twitter at Healthcare SECR and the number 1. And you can see some of our shows on YouTube at Healthcare Secrets Podcast as well. Give us your comments and questions on any of those platforms, or you can write us at info@healthcaresecretspodcast.com. That's kind of leading to another solution. This is a little bit drastic because if things really turn as horrible as they could, and again, I'm not saying they're going to, but I'm just saying that it's probably something you should think about. And it's kind of what you're touching on. And it's, move to another country. You talk about this an awful lot, and you've sent me to the Cayman Islands where I've done stories on Health City. By the way, all doctors that are Indian there, who are fabulous specialists who can create not only great surgeries but at low cost. You sent me to Malaysia. I was over there in Penang, and I saw the exact same thing too. I saw costs that were set, so everybody knows what they're getting. Now, I'm not saying people should leave the United States, but if you're somebody who's really worried about your health care, it might be something for you to think about down the road, especially as you're getting older here. What do you think about that?
Oh, I think you're absolutely right. I mean, in medical tourism, that was a term that was coined by the media in the U.S. back in the 1980s, 1990s. And I think it's a bit of a misnomer because you're not going there, to have great, margaritas under a palm tree or something like that.
I am.
You can certainly do that if you want. But surgery is something very serious. You want to think about the infection rates and mortality. But what you need is the right information. That's why I built MedRetreat, because I wanted to be able to, do my due diligence and find the best places. We'd start off, every country that we went to, the first call we made was the U.S. embassy or consulate to say, who do you send your staff to? That's a good place to start, isn't it?
Absolutely.
Because they know it's just not going to any hospital. This is a funny thing. Anytime we talk about medical tourism, we'll do whole shows on medical tourism. But anytime they do a story on it in the U.S., they always end with the doctor in America saying, I think it's very dangerous. You shouldn't do that. You should not travel for it. And the funny thing is, I want people to say, I want that doctor. I want to find out who that doctor is. I want to call him up and say, you know what? Since you're so against it, why don't you call Hopkins or Mayo Clinic or Cleveland Clinic or MD Anderson? Call those hospitals and tell them that what you just said on the news.
Yeah, because they get people from going to if MD Anderson in Houston or Mayo Clinic in Minnesota. There are people that are traveling all over from the country, within the country. That's medical tourism too.
Johns Hopkins. I sat on a round table with Hopkins International Hospital several years ago, and it's funny because they have a whole international marketing department,
yep.
And their whole objective is to promote their surgical services around the world, flying in daily to undergo surgery. So that's why I would want that doctor to call them up and say, I totally don't. You should stop doing that right now. And I guarantee he's going to be like, but I don't. No, I can't do that.
Yeah.
Right. I mean,
yeah. And the question is, who are they catering to? Are they catering to poor
exactly.
people outside the United States? How are poor people outside the United States able to afford that? Or are they just appealing to, wealthy dictators and statesmen from different parts of the world that want to come here because they like our healthcare system better? That's the thing that doesn't make sense to me.
Yeah, well, it's definitely the older, the more wealthy statesmen and the global elite, but they also cater to upper middle class around the world. So that's definitely a big part of it.
Wow. All right. Well, that's good. I think we've kind of covered an awful lot here as it is. We got a lot more solutions coming up. And Judd, in your book, you only cover about 2 chapters, I think, on medical tourism, right? Because a lot of them you're dedicating just a whole wide range of solutions. But I think it was just 2 from what I remember reading it, right? 2 chapters?
Yes, 2 chapters. You're right. But what I want people to think about when you think about medical tourism, it doesn't always mean traveling to some far off country. You can stay here in the States. Remember in the first episode, we talked about the Surgical Center of Oklahoma. That's in Oklahoma City, and you're going to save a lot of money by going there. Rockville affordable hernia surgery. I mean, if you live in California, you're going to save tons of money by flying to Washington, D.C. and going to that clinic if you need a hernia repair and you have to pay cash for it.
And you're finding other cities like Las Vegas is really trying to push medical tourism. So they're beginning to get some doctors and surgical centers that are doing the exact same thing there. People are going to Mexico. Just go across the border, and they're getting especially a lot of dental treatment, nips and tucks as well. So there's a lot to be had that's not that far away to people here in the United States. No, you're absolutely right.
You bet.
All right, so we got a lot to cover here that we've covered already, but we've got a lot more coming up for future podcasts. Give us a little hint of some of the things that we're going to talk about, Judd.
Yeah, there's certainly so many topics that we're going to keep this going for quite some time. But one that really affects a lot of people, even with insurance, is in-network, out-of-network. Depending on what kind of insurance plan you have, you only get to see a certain number of doctors in a territory, right? That's in-network. If you go there, they cover everything. But what happens if you're out of network? So we have a whole show on that, and some of the things I'm going to tell you about are truly shocking. But once you learn this, you're going to just be an expert and know what questions to ask to avoid these charges. Yeah. And then we're definitely, like with medical tourism, we got a lot to talk about with Health City, Cayman Islands, because that's very close to the U.S. and a very special place. So yeah, there's many topics that we're going to cover, and literally you're going to save thousands of dollars and be a very smart healthcare consumer by listening to this.
And one of the things that I'll just slip in there before we say goodbye is the fact that you and I are both members of Liberty Health Share. We are with medical cost sharing, which it gives us control of our health care. At the same time, too, reduces our costs. And we get to choose what doctor we want to go to and where and when. So I would just say to folks, if you can, take a look at libertyhealthshare.org. What's the site you want them to go to, Judd?
Yeah, on our homepage. Yeah, on our website.
On our home site. Okay, just take a look at that. Just go click on that and take a look. If you can, just enroll. You don't have to sign up. Just take a look at it, see what you think. We're going to talk more about Liberty Health Share and other things coming up on future podcasts. Again, this is the Healthcare Secrets Podcast. Their website's really easy, healthcaresecretspodcast.com. You can see us on Facebook at Healthcare Secrets and on Twitter at Healthcare SECR, the number 1. And you can see some of our shows on YouTube at Healthcare Secrets Podcast, youtube.com/Healthcare Secrets Podcast. Give us any comments or questions you have. You can do it on those platforms, or you can write us at this email, info@healthcaresecretspodcast.com. Judd, another great show. I think we're giving people some great stuff, and this is, even though it's annoying, it's so exciting to get this stuff out. So I appreciate it. Good show, buddy.
Likewise. Thank you, John.
All right, folks, we'll catch you next time.